All right, so here's our big update. And if you're a rural health clinic or an FQHC, this is a new change for you, a transition to fee-for-service programs. The way I like to explain Geo511 is this big soup pot where you bill Geo511, which contains all of these billing codes. And last year, CMS opened this up and said you can bill it multiple times. Now, that was definitely a good step, but there was clearly some confusion. Could you bill for the RPM setup code? Could you bill for the device code? What if you got 40 minutes of CCM? Can you bill multiple instances? And honestly, we've heard experts that insist on both sides of the argument, and we have no idea what's right. So finally, CMS is going away with Geo511. And so as of January 1st, rural health clinics and FQHCs can bill just like every other fee-for-service practice. You do many things, you bill many codes, but you can take advantages of some of the higher codes. So, Kathryn, from a clinical point of view, how do you feel about this? What's your thoughts on the impact this might have to those clinics?
I am thinking this is another positive thing. I like many others, I think found the G0511 code a bit confusing. We weren't quite sure how to use it. There was a lot of different interpretations. So I think this takes that kind of confusion out of it and lets the clinicians focus on what they should be doing, which is addressing patient needs in a rural and underserved area. That's a big enough challenge. Let's make it easier for them. So we're reducing the overall confusion. We're recognizing that there is big needs in these areas. We're also making sure providers are getting adequately compensated for these services without having to jump through so many hoops. And all of this is contributing to an overall more equitable healthcare system, which I think value-based care is doing as well. So this is another strength, in my opinion.
Awesome. So let's talk about the compensation that you mentioned. So here's what it looks like. Now, Geo511 is set to be $72.90. And I know what you're thinking. I thought it's going away, right? Well, it is, but you have a 6-month grace period to make the transition. And so on January 1st, you can still keep billing Geo511, but you also have the opportunity to switch to the fee-for-service code. So let's look at, I like to put this slide up here to see a comparison. So let's say you are doing a 20-minute CCM. Well, on the Geo511 side, you'd make $72.90. But on the fee-for-service side, using 99490, you'd make $60.49. So if all you do is 20 minutes of care management, you might want to stick with Geo511 for the next 6 months. But here's why I think you should switch. Is you can now do all the additional codes. So let's say you spend 40 minutes with a patient and 60 minutes and 30 minutes, and you did RPM and RTM and behavioral health. You can now clearly, without any hesitation, bill those additional codes. So what we think will happen and what we hope will happen is that RHCs and FQHCs, the door has opened for you to offer many programs to many patients, which overall, Kathryn, that sounds like a pretty good thing, huh?
I agree. Definitely.
So the decision you need to make if you're an FQHC or an RHC is when to make the transition. So for those of you on the webinar that are ThoroughCare clients, after the new year, reach out to your CX rep and talk through this together. Here's what you cannot do. You can't bill Geo511 for some patients, and you can't bill the fee-for-service codes for others. The grace period is to allow you to make the transition so that your billing system or a program like ThoroughCare, if you use us, can support it. Now, we're prepared to do it as early as January 1st, but if you want to hang on a little longer, you can. So think about it. Look through all the codes you built in the last years. And if you can get value out of those higher codes, I would say that you make the switch sooner than the 6 months. But after June of next year, your claims for Geo511 will be denied. And so just think about how you're going to do it.